Let's take a look at search trends. The bed bugs made the top of this list as well, but something else did as well, and that is throat cancer. When a celebrity comes forward with an illness like that, do you see a spike in people researching it, and is it a good thing in your mind as a doctor?
Yeah, I mean, we definitely see an increase. People really want to know not only about the celebrity, but about the health condition that that celebrity is suffering from. Really, the best example of when we see a celebrity get sick and an increase of patients into the system is with Clinton, Bill Clinton, when he first presented with his health problems. We talked to a lot of cardiologists then who told us they saw more and more patients actually coming into the system thinking, well, if it can happen to Bill Clinton, it can happen to me. Same thing with Michael Douglas, is he actually admitted that his throat cancer was probably related to his years of smoking and drinking. And we know that in smokers, if you drink, your risk goes up pretty significantly. So another learning point from a celebrity illness.
So I think it's really brave when celebrities are public about these things, because it does provide a public service and educates a lot of people about it. Similarly with Farrah Fawcett, who had anal cancer, which, you know, talk about unglamorous, you know, no one really heard of or discussed anal cancer, and now people were much more aware of it.
Yeah, I mean, a lot of people didn't even know there was such a thing.
And also it's important to know the association between anal cancer and HPV virus, which is the same virus that causes cervical cancer, and also turns out to cause some forms of throat cancer.
So, yeah, well, I was going to ask you about that in a moment, but what can you do in terms of, you know, they say 70% of women, I could be inaccurate about this, so please don't trust me and maybe go to WebMD and check this out. But a lot of people are walking around with HPV, and it kind of comes and goes. You can't. There's no way to get rid of it.
You know what the number you're thinking of is that about 70 or 80% of people get it, but then it goes. Well, they handle it. They deal with it, and in a smaller percentage, it stays. Like in a smaller percentage, it stays. You know,
stays forever.
It stays forever.
How do you get rid of it?
You don't. I mean, you don't. And that's why years down the road, a woman might develop cervical cancer because she had an HPV infection for years. That's why the screening is important. The screening actually not only picks up abnormal cells, but an HPV infection for cervical cancer.
And if you have HPV, do you have to have a screening more frequently? Is that generally how it works?
If the HPV is found to be associated with abnormal cells, which oftentimes it is,
But what if it's not and you just have it? Do you have to get screened more regularly?
You have several screenings closer together, but then once you're found to be then you're fine.
Also, there are strains of HPV, Katie, that are high risk, and there are ones that are low risk.
It does have a spectrum.
So if it's a certain serology that typing that says that it's high risk, you're going to be looked at more.
And that's why it's being encouraged for young girls before they become sexually active, and boys, who I see boys in the ads now, that they should get the HPV vaccine.
Yeah, absolutely. It helps prevent genital warts, obviously cervical cancer, same thing in boys, genital warts, and you know, it might actually help prevent anal cancer and possibly even throat cancer. We know that throat cancer is also associated with HPV.
And also
can we
helps
talk about that, because we're on a web show and I think we can be kind of honest
It also
here.
helps prevent the men from spreading it to the women.
Because I've heard that men spread HPV more than the other way around. Is that true? That it's carried by men?
But both partners.
I mean, it can go either way, but yeah, absolutely, that's going to be a big source of.
And obviously, if you have oral sex, you can have the HPV virus get introduced into the mouth, and into the throat.
And is that resulting in an increase in throat cancers, mouth cancers? Someone told me esophageal, but not so much? Not
so much. I mean, I have seen papillomas, which are the early lesions that you can see in the bottom of the esophagus, but really more it's been the throat and head and neck cancers. And that's been, I think that's beyond argument. I mean, I think that's been seen.